Hello and welcome to Real Health. My name is Michael Porter. There are some topics that some people are just too embarrassed to talk about, and some are even considered taboo. One of these topics is sexual dysfunction. So today we've invited Dr. Mark Opperman and Dr. Nicole Canaris to find out more about the symptoms of sexual dysfunction and the new advanced treatments available. Welcome to you both. Thank you for joining us.
Thanks.
Hello, Michael.
Now, sexual dysfunction, I mean, from a male perspective, is erectile dysfunction. That's what we know it to be and what it's understood to be. But from a female perspective, there are a lot of symptoms that I think a lot of women don't even realize are symptoms of sexual dysfunction. What are some of those?
Well, it's scary to think that 1 in 10 women never have an orgasm in their life.
Oh, wow.
So anorgasmia is one,
Okay.
where women are unable to have an orgasm.
Right.
A low libido would be another, whether it's due to hormones, psychological distress,
Okay.
marital issues. There's a whole host of things that can come into play
Yes.
there. And then lubrication, lack of
Okay.
lubrication in the area. Things are just not functioning properly down there.
Yes, yes. So I suppose the topic of sexual dysfunction is broad because there are the psychological
Huge.
ones,
Yeah.
the physical ones. What are some of the reasons for sexual dysfunction in men in terms of physical lack or erectile dysfunction?
Well, like Nicole said, it could be vast in different origins.
Yes.
The one I think we should try and focus on today is the one that men start presenting with, and that's low testosterone levels.
Okay.
Again, psychological factors here play a very big role.
So now you guys have got a lovely sort of technology, if you can call it that, or therapy called PRP. Tell us about what that is exactly.
So PRP is, we basically take the blood, and the magic happens when we spin the blood down and we extract platelets.
Okay.
When platelets are injected into any area of the body, they cause growth factors to be released.
Okay.
And these growth factors help with new, basically regeneration of that area. So there's new collagen laydown.
Okay.
So if it's in the vagina, collagen laydown, increase in lubrication because it
Right.
improves the function of the glands.
Okay.
There's new blood vessel supply. There's more sensation. Blood flow is better.
Okay. And this is the person's own blood that you've drawn out of them, so it's not like you're getting somebody else's.
This is what makes this treatment such a beautiful breakthrough in various medical modalities, from orthopedics to neurology.
Okay.
What we are using is we're using the body to heal itself.
Right.
Platelets contains the growth factors, which are like the blueprint
Okay.
for cells how to repair.
Yes.
If you think about the function of a platelet, it clots, and then that clot needs to become a healthy vein again.
Okay,
So
right.
it has the ability to heal.
Right. And is it a therapy that you would repeatedly do over time?
The most wonderful thing about this is that it's safe because it's your own.
Okay.
There's very little chance of reacting
Yes.
against the treatment. You would be reacting if against a needle or a syringe, but
Okay.
not to your own platelets.
Okay.
And yes, it's something that can be done over and over again,
Right.
because all you're doing is stimulating natural repair.
Okay. Let's stick with ladies first, Nicole. The O shot, as it's referred to, is for women. Now, what are some of the main symptoms that you would use this for that are going to have a positive impact on?
Well, a lot of my patients are postmenopausal women who
Okay.
are coming in with hormonal imbalances. They've seen their gynae, they've been to the psychologist, they've
Right.
made their rounds, and nothing's helping. They basically are dry, it's painful having sex, they've got a low libido, they don't enjoy it anymore.
Yes, yes.
So in this case, it's just basically rejuvenating the
Okay,
area,
okay.
increasing the lubrication, bringing up their libido, and it helps with that. So that's
Okay.
one, postmenopausal women with dryness and pain.
Right.
The next thing would be patients who've never had an orgasm or feel
Okay.
very little, helping to sensitize the area, make them
Right.
more sensitive.
Okay.
And then we also treat urinary incontinence for patients that have had natural births.
Right,
And
yes.
when they jump, skip, hop, laugh, or cough, there's a little bit of leakage of urine.
Okay.
So it helps to tighten the area
Right,
and
right.
increase basically the tension on the urethra.
Okay.
It was very interesting when we did the first patients. They all came back, and when we probed towards the sexual functioning, there wasn't much initially.
Okay.
And we went further, and they all reported that, oh, you know what, I don't pee when I sneeze anymore, which
Okay.
is it's a new lease on life
Yes.
for someone who constantly needs to know where the closest bathroom is.
Absolutely.
Especially on your older patients. We've dealt with 78-year-old women who literally couldn't drive, or it was lifestyles really affected, and you're basically giving them a new lease on life. They're able to go out. One of the other things is lichen sclerosis, which is a medical disorder.
Okay.
It causes scarring in the vaginal area. So they literally get an obliterated clitoris, stenosis of the vaginal canal, so they're unable to have penetrative sex.
Okay.
And it's basically a huge problem because going out, they're always itchy, they need to scratch, so it becomes a social problem where they don't go out anymore.
Right.
And just pain and bleeding, and it's horrible.
Yes.
So multiple injections in that site with PRP actually helps to normalize the tissue.
Right.
So it brings it back from being abnormal scar tissue to normal healthy tissue.
It's amazing. That's really cool.
Saving marriages. I mean, you can imagine having this disease, you're unable to have sex with your husband or your boyfriend or whatever it is.
And I mean, it's quite a sensitive region. Is it not painful to get this injection?
So you must remember the vagina's made to have babies. So the injections inside are very hardly felt. Clitoris, we use a very good local anesthetic cream and very little felt.
Okay,
Some
so
patients
it's nothing
feel
to be scared of, really.
Exactly. Some people feel nothing. It's a lunchtime procedure. You literally come for it, you go out and you carry on with your life.
Oh, fantastic. Well, okay, ladies are done. Men, let's go there. Mark, it's your turn.
I unfortunately can't say that we can do without the cream.
Yeah, the cream is great.
Different experience. So tell us, Mark, you mentioned that erectile dysfunction is often a symptom of something different. Now, what makes I believe it's called the ED or P shot for guys. What makes that different in terms of thinking about the O shot? Certainly, there are physical problems that need to be rectified. What are those in the male, in the penis, that would be that this would be useful for?
So, erectile dysfunction goes hand in hand with a decrease in blood flow to the penis.
Right.
It's sponge tissue that we need to fill.
Yes.
So, by increasing blood flow, we are able to not only reverse erectile dysfunction, some guys might like to hear this, we actually increase size as well.
Okay.
I have a lot of guys that present to me who find it very difficult to have orgasms while or during intercourse because of sensitivity problems.
Okay.
So here we use it for enhancing nerve tissue and make the corona and the glands more sensitive.
Yes.
So, a beautiful treatment to do.
Okay. Now, guys who are circumcised, there's often a loss of sensitivity and sensation from that. So without obviously regrowing a foreskin, are you going to be able to create that sensitivity through this procedure?
You will enhance sensitivity. I don't think that you'll be able to get it back to pre-circumcision, but it definitely increased sensation in the area.
Now, Mark, we spoke about the pain with females, but for guys, is it also a pain-free experience, or is it a little bit more traumatic?
As a guy coming at you with a needle in that area, it's scary.
I can imagine,
No, we use numbing cream, and it's not your over-the-counter numbing cream.
Okay.
So there's no sensitivity.
Okay.
But we do a couple of injections.
Right.
And this is a procedure that should be repeated once a month for 6 to 8 months.
Okay, so it's not so it's why, if I can ask that question, why does it need to be repeated?
Because in this area, we're dealing with sponge tissue, and we want to increase the vascularization. So the more we do it, the better vascularization we get, better blood flow, better erections.
So basically, if I'm not mistaken, if I'm understanding correctly, when you say increasing blood flow, it's not just about increasing the volume of blood that goes into the penis, it's about increasing the way that it's transmitted around the penis within the tissue. Well, it's a fascinating discussion. Thank you so much for joining us to chat about it. I think we've got many, many more discussions in the future about sexual dysfunction because it is broad. And I think it's also really great to know that there are solutions out there that are quite extreme in some ways, but not anything to be scared of, because it's a great solution to a very challenging problem. Thank you so much for joining us.
Thanks
Michael.
Great stuff.